Hello, my name is Isuo. I'm an associate professor and the program director of Orthodontic department at the University Pacific Arthur A. Dugonis School of Dentistry in San Francisco. With the increased demand for adult orthodontics, we are often faced with the challenge of correcting difficult occlusal problems. I would like to share with you one of our adult patients with multiple missing posterior teeth. A 41-year-old Asian female presented to our graduate orthodontic clinic. Her chief concern was the lip protrusion. She also had a moderately restored maxillary dentition with several missing teeth, including the maxillary left first and second molars and the mandibular right first molar. The CBCT image revealed the flow of the maxillary sinus on the left side was extended significantly toward the top of the alveolar crest, leaving only 1 millimeter of cortical bone in the edentulous space where the first and second molars were missing. In addition, the maxillary left third molar had 3 roots that were unusually well developed and the buccolingually wide major root. This case could be treated in different ways with varying degrees of restorative involvement. Since the patient's chief concern was her lip protrusion, we utilized some of the edentulous spaces for retracting anterior teeth with the aid of a temporary anchorage device. It required extractions in 2 other quadrants as well. Even after retraction of the anterior teeth, we needed to address the remaining edentulous spaces in the maxillary left quadrant. There were 2 molars missing, and the space was about 60 millimeters. These remaining spaces could be restored with the dental implants. However, it would have required maxillary sinus floor augmentation. Another option was to close the remaining spaces by protracting the third molar. A challenge with this treatment option was that the major root of the third molar was directly against the cortical bone of the maxillary sinus posterior wall. It's been known that moving teeth over a long distance through cortical bone is very difficult in adult patients. It increases treatment complexity and treatment time. After giving the patient these different treatment plans and associated risks and benefits, the patients declined dental implant and maxillary sinus floor augmentation in favor of closing the edentulous spaces orthodontically. The biggest challenge in this case was moving the maxillary left third molar over such a long distance through the maxillary sinus. I hope you find interest in treatment and the outcome of this case. I would like to thank my co-authors, our residents and faculty who are involved in the treatment of this patient. Thank you.